This is patient case number 4 for RS. So the father stops by the pharmacy counter because he's hoping to get some assistance in selecting a product. His family's on a summer vacation and they had a great day at the amusement park, except that his 15-year-old son developed a rash on his arms and legs where he applied sunscreen. Fortunately, the father brought the tube of sunscreen they've used into the pharmacy. He's wanting a suggestion for an alternative for sun protection since his family has bought a 5-day pass to the amusement park and the forecast shows sunshine for the next couple of days. He's also wondering if there is anything to help relieve his son's irritated skin. Our patient, RS, is a 15-year-old male on a summer vacation visiting an amusement park. The patient's father has visited the pharmacy and states that RS has developed a rash on his arms and legs where he applied sunscreen. This sunscreen was found to contain oxybenzone. The patient's father states that RS does not have any current medical conditions, does not take any medications, and does not have any food or drug allergies. The immunization history for RS was not discussed and is not known at the time of encounter. Our patient RS has no known drug allergies prior to this encounter. The adverse drug reactions were not discussed with the patient's father, and the patient's adverse drug reactions are unknown. RS has recently had an allergic reaction to oxybenzone, which has manifested in a rash at age 15.
We had a few questions for the father of our patient, since the patient didn't come into the pharmacy today. And they mainly were concerned with the quality of the rash that his son was experiencing. So asking further questions to kind of get a better idea about what the rash looks like and when it appeared. And then another great question to ask would be what sunscreens that his son has used in the past, because his son is 15 years old, which means he's probably used sunscreen before. And since the father is not reporting that they've had this problem before, there's probably a product out there that they've already used that hasn't resulted in such a reaction.
This is the objective information for our case. RS's father brought in the tube of sunscreen that his son used to the pharmacy that showed it contained oxybenzone. The patient currently has no known alerts. This is RS's current medication list. The only medication he used is a sunscreen that contains oxybenzone with an unknown strength. He used this for sun protection. He applied topically to the skin for sun protection, and it was unknown how often this medication is used for. He started using this medication today. RS applied the sunscreen today and noticed the rash had developed. He discontinued use after this occurred.
The first condition that RS's father wants us to take care of is RS is presenting with a rash on his arms and legs due to an allergic reaction to oxybenzone ingredient in the sunscreen used to protect his skin. We have two goals of therapy. Our short-term goal of therapy is to resolve the rash on his arms and legs to zero evidence of a rash in 2 days. And our long-term goal is to prevent rash from returning indefinitely by avoiding sunscreen products with oxybenzone ingredients. The drug therapy problem for RS is indication, needs additional drug therapy. RS needs additional drug therapy to treat the rash that erupted on his arms and legs due to an allergic reaction caused by the oxybenzone ingredient in the sunscreen he used to protect his skin. We came up with 2 treatment options for possibilities for RS. The first being hydrocortisone 1% cream, which sells at $4.52 per 2 ounces. And the second is Caladril topical lotion. Its active ingredients are calamine 8% and parmoxine HCl 1%. This sells for $5.47 per 16 ounces.
Condition 2 that we're treating for patient RS is sun protection. The goals of therapy is short-term, protect RS from sunburn during his 5-day vacation at the amusement park, and long-term, we want to avoid sunburn with the use of ultraviolet sun protection as needed indefinitely. The drug therapy problem for condition 2 is a safety adverse drug reaction. RS has a rash on his arms and legs due to an allergic reaction to oxybenzone and requires alternative drug therapy for ultraviolet sun protection.
We decided to present 2 different treatment options for the use of sunscreen, and those are the Alba Botanica Hawaiian Clear Spray Nourishing Coconut Sunscreen SPF 50 and the Honest Company Honest Mineral Sunscreen SPF 50+. We chose both of these because they both do not contain the oxybenzone, as well as also being readily available.
For RS's new medication list, we will first discontinue the oxybenzone, as this caused the rash. We will then begin the Alba Botanica Hawaiian Clear Spray Nourishing Coconut Sunscreen for sun protection, and he will apply a thin layer topically to his exposed skin for sun protection every hour while he is in sunlight. Going through the IESC, this product is indicated for sun protection and does not contain oxybenzone, so it will be safe and effective for RS. This was also chosen because it is relatively inexpensive and easily accessible at local convenience stores and pharmacies. Finally, we will begin hydrocortisone 1% topical lotion to treat the rash, and he will apply a thin layer topically to the affected area 2 to 4 times a day until the rash is not visible. Also going through the IESC of this product, it is indicated for a rash, and the active ingredient is hydrocortisone, which will be safe and effective for RS. This product was also chosen since it is inexpensive and very readily available.
Non-pharmacological interventions that can be used for sun protection include the use of a hat, sunglasses, a sun umbrella, and protective clothing. This includes tight-knit fabrics, materials that absorb UV rays, long sleeves or pants, and thicker fabrics. It is also a good idea to avoid sun exposure from 10 a.m. to 4 p.m. RS will want to keep the rash moist and avoid washing it with harsh soap or cloths. RS or his father should contact the pharmacy by telephone 48 hours after the primary encounter. The pharmacist will have the father check and see if there is a visible reduction in the size or severity of the rash. He should also have him ask RS if he is sunburned, and if so, inquire about the severity of the burn. RS will be asked if he has experienced side effects such as swelling, redness, rash, or pain. If RS experiences weight gain, swelling, or blood in the stool, he should seek immediate medical attention. Beyond the initial rash, if there is worsening of pain, swelling, or redness, he should seek medical attention as well. Here are our references.